What's up, guys? Welcome back to another video. If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Within the Academy, we offer the Clinical Coaching Specialist certification, where we teach PTs how to raise their standards and results in the clinic. In this video, we are discussing the topic of knee valgus while squatting, and we're really going to attack the topic of, does throwing a band around the knees actually help us or hurt us? Let's talk about it. So let's set the scene on the typical approach. Let's say you're with a patient or a client, or if you're just performing squats, and then all of a sudden you see that the knees start to cave in, and we have that dreaded knee valgus. What is the very first thought that typically goes over everyone's mind? Take a band, throw it over the knees, and tell that person, or you yourself will drive the band out into external rotation to help fight knee valgus. And then you ask yourself, why is this happening? And usually the very quick response is, this person's glutes are weak. We need to externally rotate. We need to activate the glutes during that portion when the knees are caving in because their glutes are weak. Now I want to discuss why maybe that's not the full picture, and maybe we need to reconsider it. So if someone is able to go through a full range squat, they're typically going from around 0 degrees to 120 degrees of hip flexion. We typically will see this knee valgus occur around the 90-degree mark. And so as we approach that 90, we start collapsing inwards. Well, if we dive deeper into the mechanics of the hip, we can start to notice some things that maybe we didn't see before that helps us gain a little bit of clarity behind this knee valgus phenomenon. So I want to briefly go over it. So we can look at 3 different phases of hip flexion. We have 0 to 60, which is represented by an ER bias, 60 to 90, an IR bias, and then 90 to 120, an ER bias. And what this means is that they've done research and shown that that 60 to 90 degree mark, a lot of our classic external rotators, like the glute max, like the glute med, like the piriformis, they actually start to bias internal rotation, meaning they are producing internal rotation. And it's because the actual orientation of how these muscles sit now change as it relates to the femur. And so they start to internally rotate. Now, if we look at the pelvis, we actually will have this wobble type motion. And this is exaggerated for demonstration purposes, but we'll have this external rotation, 0 to 60, internal 60 to 90, and then re-external rotation above 90. Now, if this can happen, someone will be able to keep their femur in a straight line. If this cannot happen, then someone cannot keep the femur in a straight line. And what has to happen is we have to capture that internal rotation somehow. So what's an easy way to do it? Well, if we can't get this wobble motion, this slight internal rotation, because everything is so compressed down, then the pelvis will just remain where it is. The motions that are needed will not happen, and we will just force the femur into internal rotation. And because the pelvis is more an external rotation, we see knee valgus. So what's happening here? Well, what I'm saying is that we need to have enough mobility and expansion of the pelvis to be able to go through its relative motions, these varying amounts of ER, IR, ER. When it can, we see straight legs. When it can't, we don't see straight legs. So when we throw a band around someone's knees, we're actually strengthening that dysfunction. This person is already super compressed and tight. And then we try a band around the knees and lock it down even more. Can you see how this probably isn't going to yield the most favorable results? Instead, to fix knee valgus, we need to get these relative motions back. And it's typically from 60 to 90, that IR biased phase. So instead of doing external rotation movements, we actually want to start to do internal rotation movements. Why? Because when we get more IR exercises, we're going to open up this posterior outlet. We're going to allow it to expand. That expansion is what it lacks. Someone that has to use a band probably is more so here. They lack that ability to open up and expand. So I want to go through 3 easy exercises that we can do to start to fix the source of knee valgus, and that is by opening up the pelvis and not adding a band above the knees. So the exercises that you choose can be what I'm about to show you, but to be honest, it's more about the principles. I'm just kind of giving you an easy to more intense progression as to how we can start to promote internal rotation, aka allow the backside of the pelvis to expand, to not let it be so compressed and jammed up, so that way we can move the femur in a straight line. So the first one is a piriformis foam roller stretch. I like this because we can throw the foot on the foam roller. You can bring the knee down. From here, we already have a stretch. Next, we can move the foam roller forwards to increase that stretch. And then the real bang for our buck is taking the pocket, the one that's on the ground, and rotate it towards the foam roller leg. The second we rotate towards the foam roller leg, we start to increase the stretch on the foam roller piriformis. We're stretching the side on the piriformis. A great way to start to get this pelvis moving in the opposite way that it's stuck in. The next progression we can do is a skater on the slant board. The slant board is great because when we step laterally, it's going to promote internal rotation so we can move the pelvis in internal rotation and expand the backside of the pelvis. All we're doing here is stepping laterally. As we step, we're thinking elbow in front of knee, knee behind knee. So we go into the motion. There's a definite balance component to this, but you see how I'm very twisted, like I'm ice skating. And what we should feel is that backside of the pelvis being opened or stretched. This is a great one. Takes a little bit of skill to get that balance down, but once you get it, you can work through it and really make sure you get that full rotation. And finally, we can move to a kickstand deadlift. What you're going to want to do is to bring the leg forward that you want to improve internal rotation. With the hand that's on the same side, put that right on the glute. What's going to happen is that's going to be a nice reference and cue to feel the motion going back and to cue the glutes to extend forwards. A lot of times people will squat this motion because it's a really technical lift. It's challenging. What we're looking for is a purely horizontal motion where the hip is moving towards the wall. That's where this hand's nice. You should be able to feel the hip moving back, and the second you feel that stop, that's the end of your motion. Then we give a little bit of a push to cue the hip to hinge up. And so when we do it, we're going towards the left big toe in this example. And that turn, in conjunction with this horizontal movement, is getting a really nice piriformis glute stretch. So the next time you see that knee valgus, I want you to stop and reconsider, why is this going on? What's the source? And a lot of times you'll find that it's actually a lack of internal rotation. Performing IR biased exercises and then coming back to the squat is going to yield way more favorable long-term results compared to just putting a Band-Aid on it and having the person go through external rotation, which ultimately strengthens that dysfunction. If you have any questions, leave them in the comments below and I will get back to them as soon as possible. Thanks for watching, and I will see you in the next video.